Emergency service providers work 24 hours a day, 7 days a week.
Our main purpose is to save lives.
That's what we train to do.
Somebody dies or somebody gets saved.
For our first responders, the moment the call for help comes in,
4 people in the water from a sunken vessel.
the race against time to save a life begins.
How sick is this patient?
It is a life and death situation.
Through unprecedented access
His body's starting to shut down.
We need to do something quickly. It is going to be painful.
and intimate interviews,
It'll certainly stick with me.
in this series, we're telling their stories.
It is a privilege to be able to help people. It's not something I ever take for granted either.
To change a patient's outcome feels amazing.
This week on First Responders,
Medic is just getting onto the vessel now.
a gruesome boat propeller accident
The patient's looking pretty pale.
puts a young man's life in peril.
There's a visible bone all of the internal structures. I can see everything.
An old spinal injury sparks fears when a man falls from his tractor.
He's had previous surgery by the sounds of it for spinal stenosis.
The fact that he'd already had previous spinal injuries makes it more susceptible for him to sustain a serious spine injury.
And another fall
It's really imperative that we get the foot straight and the blood flow back straight away, or you can potentially lose that foot.
but quite a different ride.
We're going up to Bay of Islands to fly a patient down to Auckland for investigation because he's having a heart attack. So all going well, be nice and stable and be simple flight down.
With regional hospitals not always equipped to look after certain cases, the Northland Emergency Services Trust chopper is sometimes called in to transport patients to Auckland.
Thanks. We're airborne out of Kensington for Bay of Islands Hospital.
What's the nature of that one? Tell me a little bit more.
He has to go down to Auckland via helicopter because he's on Airvo, super high flow oxygen that's humidified through water.
And what causes you to need humidified oxygen via water?
It's normally just if they have respiratory issues. He's stable and he could easily go by road, but because he's on Airvo, he can't.
Okay. All right, we'll start coming down. Copy.
The 60-year-old patient is quickly loaded into the chopper for stage 2 of the journey.
Okay.
Got the brakes.
Yep. Here you go.
You start getting real sore or anything, sing out and we'll do something about that if needed. But basically, sit back and enjoy the flight. We can sit you up a bit if you want, so you can look out the windows a bit more.
Yeah. Feel free to take some photos of the view if you like.
How's that?
You guys all good in the back?
Yep.
Cool. Full skin event, guys.
Full skin.
And departure brief. Let's confirm we are going to Auckland, guys.
Okay.
Cool. And we are lifting 19er.
Element 5 calls control. Thanks, we're airborne out of Bay of Islands Hospital for Auckland. We're 5 POV with a flight time of 45 minutes and an endurance of 1 hour 45.
And he's still good.
Good.
The calmness of St John critical care paramedic Jared Sharples and intensive care paramedic Leah Baker has helped reduce any anxiety, despite the potentially serious nature of his illness.
So what was it again? 455, chest pressure and neck discomfort.
He's had neck pain, left-sided neck pain for the last couple of days.
That's
Woke
right.
this morning with central chest pressure and pressure in his jaw.
The history of heart issues means he potentially needs another stent.
Thank you, just an offshoot. Thank you, all ops normal.
Right. Don't worry, we won't just throw you out. We'll wait for the ramp. How'd you like that flight?
It was different.
Quicker, eh?
Very quicker.
Still pain-free?
Yeah.
That's good.
The inter-hospital transfer's taken the chopper 45 minutes instead of 3 hours by road. But for Leah, her next job is far more taxing.
The initial information that we were given was that we were responding to a 20-something-year-old male off the coast of Mangawai who had been stuck in a propeller. We were told that he had a large laceration to the back of his leg and that currently he was still stuck in the propeller. I have been a winch medic for about 5 years now. Live winch rescues are exciting, adrenaline-filled, and one of the things that I enjoy the most about my job.
Be cleared to bring the medic to the door on safety. Clear the door. Cool, medic is coming on comms, and I'm moving her to the door now on safety. Understood.
It was quite a complex environment because prior to our arrival, a yacht had turned up to provide some assistance.
The medic suspended the door on safety, just taking her off safety now.
They had tethered the dinghy to their yacht to help stabilise it and keep them together.
Clear to climb.
As we were circling, the surf lifesavers arrived. So then we had 3 boats, 2 small inflatables, and the yacht, which poses extra difficulty because of the masts. The helicopter can't get as close as it usually would or as low as it usually would. So the decision was made to drop me directly into the water rather than on the boat.
Water right one, water right one. And steady, steady there. I'm just going to put the medic in the water now. Steady. We've got good clearances throughout. Medic is in the water, 55. Medic is approaching the vessel.
When I get closer to the vessel, I can see that there's a visible amount of blood in the cabin on the floor. So I know that the injury is significant.
Medic is just getting onto the vessel now.
I found that the patient was extremely pale. There was a lot of blood loss. He had a large laceration to the posterior aspect of his right leg. It extended from almost the middle of his thigh down to the middle of his calf.
So she's going to speak to us via the surf lifeguard guys.
He was critical. He had lost a lot of blood. I couldn't feel any of his radial pulses. Logistically, my mind went to how I was going to extricate the patient from the vessel. I decided to bandage around his wound to make it even bearable for him to be winched up to the helicopter. And I need to brief him. That includes what's going to happen when we get up to the helicopter.
The patient's looking pretty pale.
He was in shock. I was very concerned. My priority was to get him off the boat and into hospital, which is where he needed to be.
We've got good clearances throughout.
The Northland Rescue Helicopter Service is off the coast of Mangawhai, where a 21-year-old man has lost a huge amount of blood after catching his leg in the propeller of a boat.
He was time critical and he had a life-threatening wound, so I was very concerned.
St John intensive care paramedic Leah Baker has been winched down to his rescue.
I had to get him off the boat.
Helipad forward. We're just motoring slowly forward at 1.3 knots. You want us to go faster or slower, just let us know, over.
From helipad forward, you can hold that line. That's perfect. Thank you very much.
Probably boat rescues are the most complex winch rescues that we do.
Right, 3 and steady.
Steady. And height's 55.
You have the movement of the helicopter and the movement of the boat, and then you have the movement of the ocean.
Forward right one.
Forward right one.
And steady.
Steady.
Here. Clear to winch in.
Steady winch.
Forward right one.
Forward right one.
And steady.
Steady.
Weight of 2 coming on now. Back and left.
Back and left.
Clear the vessel. Clear back and left. Power 75. Descent to 50.
Descending 50.
Target at your...
My target.
2. Copy that. So your target.
And 50 feet you got?
Yeah. Medic is approaching the vessel. Good position, good height, good clearances.
George followed instructions. In situations like that, it can be quite rough and ready.
Patient up to the door. This may be a bit challenging with this patient, but let's see how it goes.
With his injury, we just had to do the best we can. He did really well.
Yeah.
And bring them both inside.
Both inside.
Often we are described these outrageous injuries by members of the public who often don't see injuries to that extent. When I saw George's injury and realised that it was actually just as significant as described, it almost feels like we're justified in being there because he was so unwell.
It is all the way up here. There's visible bone, all of the internal structures. I can see everything all the way up.
All right. Let's get him on some oxygen.
Yeah.
There's no bleeding. We won't do anything else.
No, he's got that tourniquet on.
Yep.
Before I bandaged his wound, I could see all of his internal structures down to his bone and his thigh.
I'm just going to do a quick 40. I'll leave you with the rest. Just get some monitoring on.
Yeah.
He's looking...
pretty painful.
It's right to here.
Yep.
The amount of blood loss that he had suffered was extensive.
Did it look like it was arterial at any point?
I couldn't see any arterial bleeding, but there was quite a lot of blood in the bone.
The longer he waits for things like blood, potentially the worse his outcomes are. So getting him to hospital is my main focus.
You would think that the popliteal artery has been severed, but he would exsanguinate, you would think, so.
Yeah, I mean, it was pretty incredible.
I was really surprised that he was still conscious, basically.
He hasn't been given any pain relief either?
No, he hasn't.
Okay.
It was perfect conditions. We were, travelling at some speed, so I was holding on tight to each sort of pontoon. We hit a wake. I go catapulting out of the boat. I was sucked underneath the boat. My arm and jumper have been completely caught in the motor, and I'm getting pulled under at this stage. Yeah, I was freaking out. The motor's completely jammed up in my jumper. I pull my head from out of the hoodie and rip my arm free. I didn't even realise I'd injured my leg at this point until I look at my leg and my calf is just hanging off the bone. And I knew something serious had happened. I've never been more scared in my life. Began to realise that my body was shutting down and I was dying. And yeah, from then on I was sort of able to say to myself that, I'm not gonna die on this fucking boat. I'm gonna do my best to get out of this.
George was status 1.
You're okay.
He needs to be in a hospital as soon as possible.
I hear that chopper and a helicopter has never sounded so good. And then a lady dripped heel to toe in black, almost like Navy SEALs, comes down on this rope, dives into the water.
Medic is in the water?
No, I've never heard myself described as a Navy SEAL before. Yeah, I mean, it's wonderful that people are so grateful, and I'm pleased that I could be there to help him when he needed it the most.
Bringing the medic and patient up to the door.
It's really hard to hand a patient over to ED and not know their outcome.
Visible bone, all of the internal structures. I can see everything.
I would love to know what happens to my patients, but sometimes it's just not possible.
Sort of woke up in the hospital. They sort of let me know how close I was to dying and that I'd lost, close to 3 litres of blood. And if the blade had hit the artery, I wouldn't have lasted more than 5-10 minutes. My mate Jamie took control of the whole situation without hesitation, grabbed my leg, raised it over his shoulder, grabbed one hand on my calf and grabbed the blanket and basically bear hugged the back of my leg. I remember he was just clamped onto it and got my other mate to wrap a tourniquet around the top of my thigh to stop the bleeding. A surgical team came in to tell me that I can expect to be losing a leg due to the extent of the injury. And all the tendons and nerve highways that feed the rest of my lower leg had been completely severed in half, and it had even taken nicks out of my bone. I had the Middlemore plastic team go into surgery, stitch all the muscle belly back together, all the tendons. They were able to fuse all the main nerve highways back together to let the nerves start regenerating and sparking. I was in the burns unit in Middlemore for about a month. I saw psychologists, nutritionists, and more importantly, the physio team who had taught me to walk again.
So I was keeping forward,
Yeah, just keep it, yeah.
I still remember the first time getting out of my hospital bed and the physio telling me to go easy, and me just being me, just hopping straight on out of there, and then almost fainting with exhaustion. It's been about 5 months since the accident. I've had a really good core around me of people who have helped out. I'd love to say a massive thanks to everyone that was involved. And of course, my mate, Jamie, who saved my life. I've started playing basketball. My physio's been really good at turning everyday activity into physio, always focusing on my leg when I'm, messing around shooting hoops. I couldn't be more grateful.
Hook is attached.
They saved my life, and without them, I wouldn't be here.
Weight of 2 coming on now.
My main concern was that he would lose his leg. I'm thrilled to hear he hasn't.
Approaching the vessel, good position, good height, good clearances.
If we had been unable to rescue George that day, he would have been taken to the beach by the surf lifesavers and then transported by road to hospital. That's about an hour's trip.
Not far, George, okay?
Versus our 6 minutes. He was time critical, and I think it greatly improved his outcome. Water rescues are few and far between, and with George's significant injuries, it's a job that I won't ever forget.
The Auckland Rescue helicopter crew have received a call out to a tractor accident on Waiheke Island. Initial details are often limited, so the team need to prepare for the worst.
There was some notes that the patient was under the tractor. Our first concern was, had he been run over? You can anticipate some quite severe trauma. So that was on our mind. We got blood, we got everything that we needed, put it in the helicopter, and we raced out to the island.
More information about the patient's medical history is sent to the crew during the flight.
He said previous surgery by the sounds of it for spinal stenosis. Yeah. Which means he's probably got a rigid spine.
Yeah. The fact that he had already had previous spinal injuries and a condition makes it more susceptible for him to sustain a serious spine injury.
Descending.
Roger. We didn't get too many updates on the way about the condition of the patient.
Any agenda peeps you want me to shut down?
Yes, please.
Yeah, it might be a slow transfer, I think.
Access out the office. You guys are clear, right?
Thanks.
Thanks.
We met the ambulance crew at the landing pad at Waiheke.
Hey.
Tony, thank God, it's made me feel so much better.
Hey, Stefan.
Hello.
His daughter was in the back of the ambulance, and she was quite relieved to see Tony Smith. She knew Tony because she worked at Auckland Hospital.
Hi, Tony. And this is my dad.
So this is Paul. He has been on his tractor today. He's pulled up at the petrol station, and then we're not too sure what's happened. He doesn't remember, so we're not sure if it's been a medical event or if it's been he's slipped and fallen. So he's been found under the tractor, unconscious for a period of maybe 2 minutes or so.
When you say under the tractor, as
like, well, beside the tractor, but his legs were kind of under it. They definitely didn't go under it. And his GCS has sort of been mostly 14, just a little bit confused about remembering events and things. And
we got a handover from the crew.
He's got tingling in his hands, and I've barely been able to palpate his neck because he was in so much pain, couldn't even touch it.
His blood pressure, his heart rate, where his pain was, where some of the numbness was. And you know, the interventions they had performed.
He has got a contusion on the back of his head, but obviously we can't see it very well. But there's just been a tiny little bit of blood on the back of on the towel when we just collar on and moved him. His lung sounds are nice, clear and equal, but he is saying that it hurts when he breathes in his back across the
It's not hurting so much.
and it's still, yeah, okay. Your blood pressure's still 160, so I've been giving him doses of 50 fentanyl, and we're up to 150.
Paul, how are you at the moment? How are you feeling?
Well, it's the pain across the shoulders is the big thing.
We normally do like to reassess the patient and then make decisions on the best way forward.
Do you know what day it is today?
It is, let me work it out, it's Saturday.
Okay. Part of our neurological exam is what's their level of consciousness like.
My name's Stefan. G'day. I want to see if you can remember my name. I'm going to ask you again in a few minutes.
If people have sustained a head injury, one of the signs will be you can't remember what's happened a minute ago. So if I introduce myself, this is my name, and I'll ask them to remember it, and I'll ask them again in a couple of minutes. And if they can remember it, then I'm less concerned about them having some sort of brain injury. It was quite clear that Amber was quite concerned for her dad, and Paul was in pain, and I think that was his focus.
Got cervical stenosis severe up here and other bits, and his lumbar decompression about 11 years ago.
Yeah, and he's got
a
lots
gammy
of
shoulder at the moment, has steroid injection.
He's complaining of pain.
Decompression involved fusion?
Yes, he did. Came off his tractor a while ago and he couldn't put anything from his neck down.
So he's got some narrowing of the spinal cord, and he's also had some cervical surgery to stabilise a certain part of the spine.
Based on your symptoms, we think you've probably damaged your spine in your fall, and particularly with the previous surgery you've had, it tends to make one part of your spine very rigid and the rest of your spine's not. And it puts you at increased risk of having a break in that spot. Right. And I think that's probably what's happened.
Okay. Wriggle your fingers for me. Good. Give my hands a squeeze. Does that hurt when you do that?
No, well, a little bit up at the left.
Is it pins and needles or just numb? Or both?
No, it's not pins and needles, it's definitely just numbness.
Okay.
The spinal injuries are always a little bit uncertain.
Shooting pains going from the centre out to the tips.
Sounding like spinal cord, isn't it?
So we were already thinking, quickly get this patient into the helicopter and on the way to hospital.
On farms, there's always another job around the corner, and I was planning on mowing a whole lot of paddocks with the tractor. And I thought, okay, I'll just whip up to the service station and top up the tractor with diesel. But because I was in a bit of a hurry, I neglected to follow my own rules to use prescription sunnies that adjust to the light. The other thing was wearing farm boots. I had a pair of light sandals on. So off I went to the service station, parked the tractor, turned it off. From what I hear from witnesses, I missed the step altogether, caught my foot with the light sandals, and fell backwards off the tractor, probably about 1.5 meters to concrete.
It's going to touch you. You tell me where I'm touching you.
Oh. Side of the right.
Where am I touching you now?
Right calf.
Yeah.
Does it feel normal, Paul, when he touches you?
Reasonably normal.
Reasonably normal. So he's got dysesthesia, but normal sensation.
We're going to roll you on the stretcher that you are now out of the ambulance, and then we're going to roll you towards the helicopter.
So yeah, there's a few transfers involved, unfortunately. You try and do that as carefully as you can, especially with the injuries that he's sustained.
It'll be a short fly to the hospital.
Do I get a movie?
Yeah, you can get in-flight movie, maybe some salted nuts.
He was a bit of a character, so yeah, he was putting on a really brave face. You know, he was in significant pain.
Okay, we're just going to undo these straps by your feet here, Paul.
Yep.
And then there's a hard plastic board underneath your back that we're going to take out. So the first thing you're going to feel something come out from your right-hand side.
Yep.
That's it. Cool.
Oh, I'm missing it already.
And now the next thing you're going to feel is you're going to feel one come out from your left-hand side.
Oh.
All right. Now we're just putting some seat belts on to keep you safe.
Yeah, got to have a seatbelt. Stefan, still here?
Yeah, I remember. That's good.
Thanks.
That is
I'm
good.
just checking.
Yeah, no, I was about to ask you if you remembered my name. I get a bit hurt when people don't, you see.
So he was doing fairly well, and then I think once we sort of got on top of his pain, I think people sometimes get the shock of it all kind of hits them, and they start thinking about, gosh, what else could be happening here? And for him it was, you know, I want to get back on my tractor, and A, is my injury going to allow me to do that, and B, is my daughter going to let me?
It's time to give up the tractor there. What? It's time to give up the tractor. I know it's new.
It's the best tractor I
Oh no, it's the best tractor.
I felt quite sorry for Paul.
Oh dear.
That he was a bit emotionally upset, and I wasn't sure whether it was a pain, and he said, oh, I want to be able to ride my tractor again. And I was just going, oh, if I had a tractor, and I wish I had a tractor, because who doesn't want a tractor? You know, I wouldn't want to be, you know, told that you're not riding your tractor anymore. So that's what, I felt sorry. I felt for him.
Paul, can you hear me? Yeah, okay, that's good. Hey, we're just about to take off. Are you okay?
Yeah, I'm fine.
Are you in pain, or are you just a little bit upset?
A bit of both.
Yeah, that's fair enough. All right, I'll check in with you again soon, okay?
Okay.
I'll look after you.
Things were looking positive, and you try and reassure patients, but you just can't make promises because you just don't know.
I think he's probably injured his spinal column. He's probably got a small spinal cord contusion, which is giving him that pain. But I think the chances of needing an urgent decompression is low. But I think the chances of spinal column injury are high, particularly given his previous spinal history.
We may say, look, it's likely that you'll make a good recovery, but we tend not to make promises, yeah.
You look like you're in pain. Has the pain come back?
No.
No? Are you upset?
Yeah.
Yeah. Are you upset about what's happened?
Yeah.
Yeah. You can still move your limbs, which is good, okay?
Yep.
Your column might be a bit damaged.
Tell him we expect this to be recoverable.
Yeah. Did you hear that?
All right.
So we expect you to be recoverable, yeah?
I know that.
Yeah, you'll be on your tractor and annoying Amber in no time.
I know.
All right? She's laughing.
I had a ding in the back of my head where my head had hit the concrete. I had a bit of ligament damage around the shoulder.
Paul, we're just about to land, okay?
Yeah.
Correct. All right.
I needed surgery on my cervical vertebra to allow the spine more space. Without the right people dealing with spinal damage, the chances of aggravating damage is really high.
How you going, sir? You all right?
The helicopter is just amazing for Waiheke. We really couldn't do without it. And I'm sure everybody out there in the roads and accidents and the countryside and farms elsewhere in New Zealand is just hugely grateful for the fact that the helicopters come and rescue them. And I am incredibly grateful.
At Ardmore Airport, the Auckland Rescue Helicopter Trust have just been called to the Firth of Thames, where a woman has had a bad fall.
Someone had broken their ankle and it was quite a bad fracture. It sounded quite nasty, and they were in Kaiawa, which is pretty remote.
It's an area that it can take some time to get an ambulance there.
Kaiawa. It's a lady that's got a dislocated fracture of her ankle. Anyone on the scene? Yeah, there's first response units here.
The drive time from Kaiawa to Middlemore is a reasonable time frame.
By road, that would be a horrendous trip for somebody with a bad fracture like that.
It sounded like it was quite deformed, either dislocated and or a fractured lower tip fib.
People go, why are we sending a helicopter to a fractured ankle? It reduces blood flow to the foot. So it's really imperative that we get the foot straight and the blood flow back straight away, or you can potentially lose that foot.
It's an orthopaedic emergency.
Right door's coming forward. And we're going to set secure in 3.
One of the challenges for the aircrew is to come up with a suitable landing site that's safe and big enough that we can comfortably land the 169 there, taking into consideration also where the patient is and how we're going to get the patient to the aircraft.
He was going to give the coordinates, I think, for the address, but he was going to look to see if there was somewhere more suitable.
It's a place right across the road. Yeah, it's on the coastal.
Yep, cool. It's on the main road too. Yeah, easy.
We normally get the volunteer fire guys to set up the landing site for us. They can tell us where the power lines are, where the fences are, if there's any livestock around.
Clear on safety there, Steve?
I think we're going to be all right. I can see a fire truck.
We land in very unusual places, so there can be a number of obstacles that can trip us up. Loose hazards on the ground, wires, we don't like wires.
Okay, have laid out a landing spot for us. No worries, I'll stay put.
In New Zealand, a lot of farmers run single wires across their properties, so we hit a single wire, it's going to make the helicopter come down really, really fast.
They've got wires on the far side of the road, opposite the LZ, and there's quite a few loose articles back towards the coast there near the caravan. Yep, got them.
Now, on this particular day, they picked an area where there was some loose debris around an old caravan.
It's not ideal, eh?
The helicopter we have has got a huge downdraft. We tried to eliminate blowing things around.
There's a spot out there left, closer to the road.
Yeah, that's going to be a better option. It looks like there's a fence there. Is there a gate there, sorry?
There's a gate over there at our 11 o'clock.
Yeah.
We decided that we wouldn't land where the fire guys wanted us to, only because they hadn't seen the obstacles we could see from the air. So we chose another spot just further down the way with good access to the patient.
Set down secure, right door is coming back. Right door's back and secure. Tail's well clear to the 6 and we're well clear below.
Okay.
Looks relatively flat.
Coming down.
Yeah, down your discretion.
By that stage, I knew there was already an ILS paramedic from St John already there. All I did was take just our alpha pack and a splint module that we take that's got some splints that we would use to stabilise the injury before we transport them.
This one? That one? Oh, cheers, mate.
Inside, the patient Jasmine has been treated by ambulance staff and medicated for her pain. But paramedics Rusty and Russell can see just by looking at her that she needs urgent medical treatment.
Straight away you can tell that she's suffered a fracture to her ankle and it's dislocated at the joint as well, so it's sticking out at 90 degrees. So it's really, really important that we get that foot straight as soon as we can and return that blood flow to the foot.
It's also about preventing nerve damage, reducing bleeding, swelling, etc.
So what we're going to do is we're going to get one of our splints ready. We're going to give you, so the medication that Wayne's giving you now, we're going to give you a bigger dose and it's going to put you in a happy place. And once you're in that happy place, we're going to sort that out for you. Okay?
It was like, okay, we're going to reset your foot, which is like music to my ears. I was really excited by that, so I wanted it to happen.
Jasmine's ankle needs to be put back in the correct position as soon as possible, but the urgent procedure is not without its risks.
To be able to reduce fractures or dislocations like that, it is going to be painful.
But it was just a simple step that started it all.
I was walking down the stairs and I stepped off the last step onto the wet tiles.
I washed the floor and, you know, it was wet. And Jasmine just took that one step and I saw that leg give out and, boy, she just went straight down.
I could feel something popping from my foot and I looked down and, yeah, my foot was just facing the wrong way.
And then it was like, fix me.
I looked straight at Ollie and I said, just pop it back in place now. Like, do it now while I'm still in shock.
Often all it takes is just to place your foot down at an awkward angle. Lower leg fractures and dislocations are relatively common, especially when there's a bit of force involved.
With Jasmine's fracture, we had to straighten it fairly quickly.
40 ketamine.
They're fortunate we've got medication that we can use so that they're not going to feel it. There would have to be some serious cardiovascular issues to even consider straightening it and reducing it without the use of ketamine.
The guy gave me some drugs, and that was pretty freaky.
A lot of people have funny reactions to it, do funny things, say funny things.
The guy was giving it to me, and I was looking at his face, and then there were like 10 or 20 of his face, and I could see the universe all folding in on itself like a prism or something.
Jasmine had a typical euphoric reaction. Apart from its dissociation aspects of it, it has like an amnesia effect, so the patient doesn't actually remember anything about the procedure. So even though Jasmine is conscious, she doesn't actually feel or remember anything about the procedure.
I'm here, I'm fine.
Something is happening.
I'm here and I'm fine.
That's okay. You're doing all right.
We talk to the patient throughout, and then when they get into a happy state, they drift off and they're not communicating anymore, then we do the procedure.
That's it. Relax your grip, it's okay. Just relax.
We need to make sure that patient is at that therapeutic level or that dissociation. The amount of pain they are experiencing prior to it is substantial, but once we actually reduce it, the pain levels are going to go through the roof.
Yeah, so you can let her arm go because she's not going to be with us at the moment. So basically just hold like that and just sort of gently pull back.
It does take a bit of force. We need to apply counter traction at the same time.
So like I say, it's going to be quite a bit of knees. Hold her leg firmly. That's it. It's all done.
Once you actually reduce the limb, you can actually feel what we call crepitus, and that's the bone ends rubbing against each other and moving. And you feel that, and you can hear it.
You've done really well. It's all back in place now.
While she's still under the effects of the ketamine, we splint it appropriately, wrap it up, and then we assess the perfusion in the lower limb.
It's looking really good.
All right.
All straightened out.
Once we're at that point where she's starting to come round, the job's been done.
It's still a little bit spaced out. Yeah, we've just straightened her leg. Good. All right.
I'm satisfied that we've reduced the fractures as best as we could, and then we can actually work away of how we're going to get her to the helicopter.
You look like a champ, man.
Yeah, so off to the bone doctors. There was no ambulances available to transport Jasmine down to the helicopter, so on any typical mission, we'll improvise.
Have we got a way of putting that in the back of a vehicle? Because it's quite a walk, 200 to 300 metres.
Yours or mine?
got a station wagon.
Doesn't matter what it is. Yeah, let's do that.
I remember coming out of the haze and I was being put into the back of a station wagon.
Oh, thank you.
In the Firth of Thames, Jasmine's fractured ankle has been manipulated back into position. She's had to be heavily medicated to manage the pain. And the next challenge is figuring out the safest and least painful way to transport her to the helicopter.
Sometimes you've got to utilise the tools you've got at hand. Obviously in a controlled setting, we had the road closed down. The quickest way to get the patient loaded into the aircraft was in the back of someone's station wagon.
1, 2, 3.
Jesus Christ, am I not up yet?
Oh, good.
You're a character.
Everything's good.
When we're dealing with a patient that has an injury that isn't life-threatening, it's a much more relaxed environment amongst the crew. You know, we can see the funny side of the patient's reaction to the ketamine.
It's okay.
It's okay.
Oh my God, I'm so scared.
Yep, don't be. You're safe.
Arms in.
Enjoy the fresh air.
Are we going to be okay, guys?
Yeah. I think we're going to be okay. That medication's going to have a little bit of an effect on you.
Am I strapped in?
You are strapped in.
Yep.
You're putting me in the back of a van.
Yeah, they found you a V8.
Yeah, you're going in the back of the Missy, all right? Just to get you down to the helicopter.
Where's Ollie?
Hop in, and we'll see you down the road. All right.
Thanks,
Unless you need help.
I still wasn't quite right at that stage. It felt amazing, actually. It was really crazy, the station wagon driving to the helicopter. It was like I was in a bit of a roller coaster at that time.
So it was 50, 20, 30, and then a further 40, wasn't it?
Yeah. Still spacing out a bit. Hey,
It's a little bit uncomfortable.
Okay.
Come into real quick.
Yeah. We'll give you some more pain relief. Yep.
It was so huge having Ollie with me. He was just a massive pillar of strength from the beginning.
They live on Waiheke, so it'll be Auckland. He was wanting to know if he could come, but I said we'd have to ask you first. Is that fine? Yep. Cool.
Just held my hand the whole time and it was awesome.
You can come.
Thank you.
Yep, you can come for it. So
I was so grateful when they said he could ride in the helicopter. It was just huge.
Should we get you loaded, eh?
I'm here so for you, babe.
Coming.
Totally.
You can wave at your house as we go past. Here we go.
Sorry, guys, but stressful, eh?
Okay.
Just a wee bit.
I'm used to it.
She was delightful. She was actually a really good laugh.
Don't you bloody touch that ankle, mate.
Not touching it. Not touching it.
Sweet.
We have to put a large aspect of that down to the effects of the ketamine, but it only lasts for a certain period of time, and it's just a case of keeping her reassured.
We're going to do your bounce up so you don't run away.
I hate running.
Huh?
Running is for
Running's
criminals.
probably not a good use of words at the moment because you can't run.
No, don't be running for a while.
It's good to make something a bit lighthearted because we want to make the experience as pleasant as we can for them. That also aids in their recovery, their emotional recovery as well.
Your partner, he's going to be sitting right here, so you can see him, right? It's not far to Auckland Hospital from here. If it gets really sore, I want you to give me a thumbs up.
Oh, okay.
Show me how you do it. Yeah.
This type of job is not very what we call high acuity as far as our medical skills go, but to actually help Jasmine take her pain away and get her foot back to a normal position where she's going to actually have a good result. Sometimes the low acuity jobs are the most rewarding because people are more appreciative of what you do.
Thanks, Wayne.
Explain here how the seatbelt works. You better swim.
You're the best.
Was I talking during that procedure?
A lot.
Yeah.
I went to different gravities. You know what I mean?
That's where we wanted you to go.
Hey, nose is coming to the right, tail's clear on the left.
Westpac 2 departed the scene for Auckland City Hospital. We've got 6 POB, 1 status 3, got 100 minutes fuel and a start time of 1700.
When we were flying to Auckland City Hospital, there was a bit of a traffic jam on the roof and we had 3 helicopters on the roof already.
There's no urgency for us, Steve.
Yeah, no, I've been on the pad with 3 on before.
Yep.
Oh, Westpac 3's coming in as well.
Goodness me.
I'll have to wait.
To have all landing areas occupied is not a common occurrence in my experience.
What status is their patient?
So we can
there we go.
hold and wait up here.
Not urgent.
The pilots liaise between each other to ensure the patient that's most critical is able to land on the helipad.
She was very stable. I just relayed to the crew that, you know, we're a low priority now. It's a case of working with each other and all about timing of who gets in first and what the needs are of the respective patients.
How's your foot feeling?
Really balloony.
A little bit sore.
A little bit sore.
Okay.
Yeah.
If we help you, do you think you could do a bump shuffle down and into a wheelchair?
Yeah.
And we'll support your leg the whole time.
Cool.
Okay. We're just going to shut down and get your wheelchair. All right. Okay. Off comes.
I'll go get a wheelchair.
Thank you.
On a personal level, that's what I get out of this job is that, you know, we go along, we make the most of a bad situation and we put things right and we do the best we can for them.
Thanks, guys, so much.
Yeah, thank you. Thank you for letting Ollie ride with me too.
Yeah, look, I grew up with MASH.
Thanks, driver.
Professionalism of the crew was just so fantastic. And it just moved like a well-oiled machine.
Did you reset it, man?
Sort of.
Sort of.
Sort of.
So it's always rewarding at the end when we've completed a mission and actually helped somebody.
Well, we need to have an X-ray.
You need an
It's in the
X-ray.
right spot.
There's a very high chance that you've broken it.
Oh, as well.
You've got the 2 bones that go into the ankle.
Might be a little bit floating around in there.
It's hard. It's impossible to know exactly.
Was it quite crunchy, bunchy, was it?
A little bit crunchy.
A little bit crunchy, you know, more than your cereal.
If we weren't available, she would have had to go by road in an ambulance, which would have been very, very painful and sore. Our flight time's, 10, 15 minutes, and she's in ED and seeing the doctors that she needs to see.
Obviously, the foot got dislocated, but in doing that, had crunched on this part here, and so that part of the bone was sort of off, broken straight off. So they put a metal plate in and 3 screws. I was in the cast for a couple of months. For about 3 months, I was wearing a moon boot as well. Maybe a year, I think, I'll be walking properly again and feeling better. A horrible thing happened. It was so painful and so scary, but I felt a huge amount of gratitude just the whole time, and relief, and just the most awesome feeling that as human beings we're all here to really help each other, and that whole, I guess, testament to civilization really, that we have roads, ambulances, helicopters, doctors. I mean, it's just awesome. It's a great time to be a human.
Next time on First Responders.
Unconscious, 225 mile an hour hit from a car.
A life and death emergency when the drag races go wrong.
That sort of impact, man, that can do some devastating stuff to your body.
For
For a 2.5 metre dinghy, he's a long way from home.
A hapless fisherman gets more than he bargains on.
Got an outgoing tide, and there's not a lot between him and Chile.
Oh, he's in the island, all right.
And a bizarre overnight stranding in a Canterbury river.
I don't think I've been that pleased to see anybody ever, apart from my wedding day when I saw Sharon.